Today we're going to talk about sleep. Sleep is a restorative process for our body. Our internal circadian biological clocks regulate the timing of periods of sleepiness and wakefulness throughout the day. The amount of sleep we need changes throughout our life. As adults, we need approximately 6 to 8 hours of sleep per night. In the past 100 years, we have decreased our average nightly sleep time by about 2 hours. America's sleepiness is a threat to public health because of sleep deprivation, workplace scheduling, untreated sleep disorders, workplace accidents, and falling asleep at the wheel. Sleep debt can cause lack of concentration, poor testing skills, and decreased productivity. Insomnia is the inability to fall asleep or to stay asleep. It is more common in women due to pregnancy, hormonal changes, and caregiving tasks. It is also more common when sleeping in a different environment or during times of stress. Some possible causes of insomnia include stress, depression, anxiety, intake of caffeine, alcohol, or nicotine products, shift work or time zone changes, medications, and poor sleep hygiene. Insomnia may be acute or chronic. Acute insomnia is more related to stress, jet lag, a new job, or a new relationship. Chronic insomnia may begin with short-term insomnia. However, it can also be related to anxiety or depression, medications, more common in women we find. It may be physiologic, meaning our brain won't turn off, or there could be cognitive factors such as being so worried about something. Additional behavioral factors also can lead to chronic insomnia. Insomnia treatment options may include the practice of good sleep hygiene, relaxation exercise, education of bed partners, sleep restriction programs, cognitive behavioral therapy, light therapy, and medication. The amount and quality of sleep has a big impact on your physical, mental, and emotional health. Many people suffer from decreased quality of sleep. Common conditions that may impact sleep include chronic pain, headaches, anxiety, sleep apnea, and chronic fatigue. Here are some strategies to help you get the most and the best quality sleep possible. Sleep hygiene refers to habits and routines which promote restful sleeping. Some strategies may include these daytime strategies of beginning your day within 15 minutes of movement, incorporating moderate to vigorous exercise 20 to 30 minutes per day whenever possible. Limit your stimulant intake, such as caffeine, alcohol, nicotine, and sugar, and limit any daytime napping. Nighttime strategies may include maintaining a consistent sleep and wake times. You may use alarms to help with this. Get into bed when you are tired. Develop a relaxing bedtime routine. Create a supportive sleep environment. A dark, quiet, and cool room is best. Write down a list of worries or thoughts that you have for the next day and put them off your mind before you go to bed. Limit the use of any electronics like cell phones, computers, and TV. And give your body time to adjust. Retraining your sleep pattern does take time. Keeping a sleep diary can help you to identify patterns that either improve or impact your quality of sleep. Things to pay attention to include sleep and wake times, physical activity, sleep quality, fatigue levels during the day, and caffeine intake. If you have made a consistent effort to follow these guidelines but are still having trouble sleeping, speak with your provider because a referral to a sleep specialist may be needed. As we age, our bodies become less skilled at maintaining sleep. Both our melatonin and growth hormone levels also decrease with age. Capitalizing on good sleep includes avoiding heavy or spicy foods which may cause heartburn, reducing stress, being aware of shift work, travel, and jet lag that it can affect our sleep patterns, reduce our environmental noise, pets in the bedroom, and children, and factor in our medications that we take, prescription and over-the-counter. Creating a bedtime routine is so important for the quality of our sleep. We can start with dimming the lights in the early evening hours as it starts to get dark outside. Reading a book, brushing our teeth, and getting our pajamas on are also ways to help prepare our bodies for getting ready to go to sleep. While everyone enjoys a good nap, there are differences between a cat nap and a long nap. The maximum nap time should be only 1.5 hours or 90 minutes. We should nap only if a nap makes us feel rested, and do not take a nap if unable to get to sleep at night. Good sleep also depends on having no caffeine 4 to 6 hours before bedtime. We should also focus on having no alcohol 2 to 4 hours before bedtime. It is also recommended to have no heavy exercise 2 hours before bedtime. Don't go to bed hungry, but also don't eat a heavy meal. Relaxation exercises, whether it be meditation or even counting sheep, can help us to better be able to fall asleep. It is important to not be a clock watcher if you are having trouble falling asleep, but rather get up after 15 minutes if you are unable to sleep. Sip some hot tea, decaffeinated of course, read a book, but be in dim lighting. Physicians specializing in sleep disorders consist of pulmonary physicians, neurology, and mental health. A referral to a sleep specialist may be needed if you are having trouble with your sleep. If a sleep physician recommends for you to have a sleep study, it will be done at a sleep disorder center. There you will sleep and have many things recorded during the time of your sleep. These include brainwave activities, eye movements, your breathing pattern, your heart rate, oxygen levels, and leg and arm movements. Sleep is a lifestyle choice and should be a priority for everyone.